Good afternoon and welcome once again to a weekly COVID-19 public health update with Montgomery County Executive Mark Elrich. I'm Lorna Badilla, Hispanic Public Information Officer, and joining us today, it's the team, Dr. James Bridgers, who is the Acting Health Officer, Dr. Earl Strider, Assistant Chief Administrative Officer, and Shauna Dano, who is Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. And today we do have a special guest, last but not least, Rich Madaleno, who is the Chief Administrative Officer. Thank you, reporters. We do have today a hard stop at 1:30 in the afternoon. And remember to use the chat during the Q&A portion of this presentation. And with that, good afternoon to you, Mr. County Executive. Welcome.
Good afternoon, everybody, and welcome again this week. I want to start today by acknowledging that today is the first day of Pride Month in Montgomery County. And throughout this month, Montgomery County is going to be celebrating and honoring our LGBTQ community. And this morning, I raised a pride flag in downtown Silver Spring. I want to thank the community members that came out, as well as our red shirts who were there for all they do for Silver Spring. I look forward to joining Council Vice President Devin Glass and the County Council next Tuesday for our County Pride flag raising event here in Rockville. One of our county's greatest attributes is our commitment to inclusion, and that everyone, no matter their race, religion, ethnicity, sexual orientation, or gender identity, can live their lives without bigotry and hatred that they may face in other jurisdictions. I'm proud of the work that we've accomplished through our Office of Racial Equity and Social Justice that we stood up during my administration. The work we do on equity is very important to our LGBTQ community, many who are dealing with discrimination, isolation, threats of violence, and assaults on their freedoms. According to a report from March of this year, nearly 240 anti-LGBTQ bills have been filed in 2022 so far throughout our nation, most of them targeting trans people. The annual number of anti-LGBTQ bills to have been filed has skyrocketed over the past several years, from 41 in 2018 to 238 in just the first 3 months of this year. And as we mentioned last month, we continue to fear that the same regression that we potentially see from the Supreme Court on reproductive rights may soon extend to laws and policies that protect the LGBTQ community. As you've heard us say many times over the past few weeks, hate has no home in Montgomery County, and we're going to ensure that the rights and resources to all residents will continue to be protected. We're also very fortunate to live in a state that is equally committed to protecting our LGBTQ community. I want to thank our council members as well as our state and congressional elected representatives who are all as equally committed to this issue as we are in the county. This year marks 10 years since Maryland became the first state in the nation to extend marriage rights to same-sex couples by popular vote. As we honor and celebrate our LGBTQ community during Pride Month, we must recommit and continue the fight for equality, inclusion, and protection of our LGBTQ residents. I encourage all residents to participate in Pride Month events, gatherings, and educational opportunities that the county government and our community partners will be hosting throughout this month. On another historical note, I want to just make note that the city of Tacoma Park in 1993, when I was on the city council, passed one of the first domestic partnership laws in response to hospitals not allowing the same-sex partners of patients to visit them. It was against hospital policy that when visits were confined only to family members, or if parents objected to having a same-sex partner come and visit their partner in the hospital. Our domestic registry legislation acknowledged that these partners were in fact family members, and it resulted in changing visitation policies. And it was an important step toward the full recognition of same-sex marriages. That was almost 30 years ago, and we've come quite a distance in 30 years. Today, I'm joined by our CEO, Rich Madaleno, who's going to provide you a quick summary of our Fy23 budget that was approved by the County Council. Before becoming CEO in 2020, Rich was my director of the Office of Management and Budget. We're very fortunate to have Rich's budget expertise and leadership skills as our CAO. I want to thank him and all of our Assistant Chief Administrative Officers, budget and finance teams, as well as all of our departments for their work on this budget. I was very pleased the council agreed with 99.8% of my recommended budget. This budget will also grow our reserves, help preserve our AAA bond rating, and provides improved compensation for our employees. The real story of this budget is not the things that we were able to fund, but the increase in our revenue. And the projections that our revenue growth is sustainable for a number of years have come from the state. So now we're finally having the revenue we need to make the key investments, as well as right-sizing many of the priorities after years of cuts and same service budgets. This is a long way from just 3 years ago when we inherited a $90 million budget deficit in our first budget. I had my first meeting 2 days after I had been elected and told that I think I had a $45 million shortfall, and it just got worse from there. A same services budget in our second year at the outside of COVID limited what we were able to do, and our budget last year, which was supplemented by federal funds, that allowed us to continue another same services budget, but that also limited our ability to address increasing needs. A reflection of the conscience of government is found in what it prioritizes in its budgets and decisions. It is evident that in Montgomery County, we're a community committed to education, sustainability, equity, safety, and opportunities for all. I'll now turn this over to Rich to go over some of the highlights and context for the FY23 budget. We'll then take any questions about the budget before returning to our weekly COVID briefing.
Thank you very much, County Executive Elrich. I'm thrilled to be here on the briefing today, especially on the first day of Pride Month. You know, if I can take a moment of personal privilege, when I first walked into this building as a Montgomery County employee in 1995, as a closeted gay man, this was a very different organization. But thanks to the dedicated leadership of County Executive Doug Duncan, County Executive Ike Leggett, County Executive Mark Elrich, we have totally transformed the culture of this organization to the point where today I have the honor to serve as the senior employee of the government, as the Chief Administrative Officer, as an openly gay person, a married man, a father. So it is a remarkable transformation that's been brought about by many of the good people of our county and successive elected leaders who stood up and fought for equality and inclusion within our community. So thank you, Mark, for telling that story about your time on the town council in Tacoma Park, and for your leadership on this, and for my colleagues who helped make this organization so friendly for the LGBTQ community, for our employees, our colleagues, and our residents. So with that, I do want to reiterate, with the budget passing, I was amazed to see that and to reiterate the point that the county council passed 99.8% of the spending that the county executive recommended in his budget on March 15th. I'm happy to tell you all that we just learned from the state of our May income tax distribution. For those of you who follow these issues, you know we get our income tax from the state in 10 distributions during the year, May being traditionally the third largest distribution of the year. And our numbers reflect continued strong performance of our economy. Our distribution is $10 million more than what we had estimated when we revised numbers in the middle of March, and it's $26 million more than what we thought we would get in May when the fiscal year started. So the economy remains incredibly strong in Montgomery County, around the Washington region, and of course across the nation. So it continues to show the turnaround that we've been able to accomplish over these years. As the county executive reminded everyone that when he came into office, he faced a $90 million deficit. We've turned that around to a surplus, reserves fully funded. Our pension system is more than 100% funded. So we are in a strong position moving forward to meet the challenges. This budget provided the largest ever support for the Montgomery County Public Schools. So when the new school year starts, they will have $2.9 billion in support from the county government and the state government. 64% of their operating budget comes from the county. It's a $138 million increase from last year. with 117 of that above the required state maintenance of effort law. So it's an incredibly generous budget for the school system. It will include expansion of, amongst other things, mental health services, with wellness centers expanding across our our county's high schools. Thanks to the county executive's leadership, we will be putting the first money into actually opening a Montgomery College East County Education Center. It's the first step towards the county executive's vision for building a fourth Montgomery County College, Montgomery College campus in the east part of the county along the 29 corridor. Look for continued news as we stand up the education center. While you will hear about the continued work on COVID, of course, our species, our planet, our community faces another existential threat in climate change. This year, the budget includes almost $19 million for the Montgomery County Green Bank to help with the transformation of our buildings across the county into green buildings, clean buildings, $1 million program to provide incentives for residential and commercial buildings to replace fossil fuel equipment and appliances with electric ones. So trying to move people from natural gas use to electric use. More than $1 million to support the county executive's building energy performance standards program, the BEPS program, which will again try to reduce the emissions that are generated from our both residential and commercial buildings across the county. It's our highest, this budget is our highest level of funding for affordable housing in the county's history. You know, due to the county executive has proposed and the council agreed to using $40 million in the surplus funds that we have this year to help support naturally occurring affordable housing. We have some opportunities to jump in and save projects, developments that are currently providing affordable housing, but for a variety of reasons might hit the market. By having this cash, we'll be able to jump in and help secure and save affordable housing while our nonprofit partners seek the permanent financing necessary to build. It allows us to partner with a nonprofit to make sure that these sorts of transactions can be made to keep and protect naturally occurring affordable housing. We have significant new enhancements. Dr. Stoddard has been on the forefront of this for the last 2 years in providing food security for our residents and housing stability across the county. And we are putting more money into economic development and workforce training so that the county remains competitive. Again, it is a remarkable turnaround in 4 years in shoring up the strength of the county, the financial picture, 100% pension liability funded. I know as Brian Sears is on the call, and Brian has sat through so many hearings in Annapolis where the state's pension liability was discussed, and we're on a cash basis, we're almost 110% funded. Our trust fund for our employee retirement program, healthcare retirement program, has $1.8 billion in assets for set aside already, which is why we had a very interesting debate this year about what to do with that money and whether or not it is time to start using some of the interest we are making on that $1.8 billion to help support the retiree healthcare program, which is what the trust fund was designed to do. You know, it is an interesting debate, and let me tell you, almost every other community around the state and country would love to be able to have this debate, because it's a sign of just how far we've come and how many resources that we have in our county to prepare ourselves for the future. So with that, I'll turn it back to Lorna for questions around the budget.
Exactly. Thank you very much. Reporters, if you have any questions regarding the FY23 operating budget, either for the county executive or CAO Madalena, this is your time. Any questions? All righty. I guess maybe later. We'll move forward then, Mr. County Executive, with a public health update.
So back to COVID. You know that had to be coming. Experts tallied 40 million travelers by air and car this holiday weekend, and airports say they're back to pre-pandemic sized crowds, but the pandemic is still a concern. We've seen case rates steadily rising here in Montgomery County for the last few months. Now, there seems to be a plateauing of those numbers, but our case rates remain the highest in the state, even though we continue to have the lowest test positivity. Our hospitalization rate has increased 25% in the last 2 weeks, but we're seeing a positive sign that the percentage of hospital beds in use by COVID-19 patients is now declining. And as you think you know, the hospitalization has become more of the marker about what kind of response we need at the community level. And it's good to see that we still, have reasonable number of vacant beds, because the concern has always been what would happen if there was a surge and a lot of people got sick and we didn't have beds. So we're in a better place than we've been, and hopefully this, the various variants of this will not alter the scenario. We remain in COVID in CDC's community level medium, but as you can see from this map from the CDC website, our neighbors to the north are currently in the high community level. Although we see better news this week, we must remain aware of changes in the virus. The incoming BA.4 and BA.5 variants could reverse these trends. They appear to dodge some of the immunity generated by BA.1 and BA.2. So people who were infected with earlier versions of Omicron could still contract the more recent subvariants. That it also applies to people who've been vaccinated. They will likely fuel more COVID cases throughout the summer. We continue to strongly recommend everyone to get tested if they've been exposed or if they're feeling ill. And please get your booster shots. It's still the best way to ensure a safe summer. And again, while you may experience a breakthrough case, the seriousness of a breakthrough case for vaccinated people is still lower than it is for those who are not vaccinated. So if you're vaccinated, keep your vaccines up to date. If you're not vaccinated, join the rest of us and take care of yourself, because more infectious variants are on the way. Finally, continue to carry that mask around with you in case you need it, such as when you're in crowded indoor space or on public transportation. Testing, vaccine, and masking, they all work, and it's helped to keep everyone safer. Today begins the start of the MCPS graduation season. I want to congratulate the class of 2022. These students were robbed of some of the best and most important years of their lives due to this pandemic, but they were resilient and they have succeeded. I think their perseverance and adaptation is going to be recognized for a long time. This has to have been one of the most challenging educational experiences that anyone could go through. And we know this is affecting the younger students who are still a ways away from graduation. This is a very special class given what they've gone through, and I look forward to watching them moving forward on the way to doing great things. On a sadder note, last week's mass shooting in Texas has required us to look at our readiness here in Montgomery County. We want to make sure the parents, students, and teachers feel safe at school. And today at 2 p.m., I'm joining Dr. McKnight, Board of Education President Wolf, Council President Albornoz, and Chief Jones on a virtual press conference to address questions and concerns in our community. I appreciate the superintendent's effort to organize and communicate clear information and tips for parents during these very disconcerting times. And there's plenty of discussion and debate regarding gun control policy and police response. We must not let intervention be ignored as a preventative measure, because when the police arrive and guns are drawn, it's already too late. Things have already gone too far. People have already descended too far down a dark path that bringing police in, it's really at the end of things, not at the beginning of things where it belongs. Just like see something and say something, all of us can help a person in mental health crisis. Mental health first aid is you helping someone you know who's developing a mental health problem, experiencing a worsening mental health problem, or in a mental health crisis. Having conversations can save lives. People with mental health concerns often keep their struggles to themselves for a variety of reasons, including fear and embarrassment. If you suspect someone is suffering, don't wait for them to come to you. Directly ask them questions like, are you thinking about killing yourself or hurting others? Engage with people you think are having a hard time, because we want to help them. We don't want these things to descend into the dark places that we see happening around the country. There are many resources out there for someone who's struggling, but when people are in a crisis, connecting with resources can seem very difficult to them. Our children need to talk to a teacher or an adult. If folks have no one to turn to or are just too ashamed to share their struggles with a loved one, we have a program called Every Mind, and we encourage people to contact Every Mind. The county contracts with Every Mind, and they offer trained staff and volunteers for supportive listening, information, and resource referrals and crisis intervention, including suicide assessments through telephone, text, and chat services. Services are free, confidential, and available at everymind.org. And they have a 24/7 phone service with Montgomery County hotline at 301-738-2255. And we're going to put this website into the chat, and we hope you'll share it with everyone. Every resident needs to take some time to learn more about mental wellness. That knowledge could help you, or it could help another person. The county also offers help for uninsured residents who may find it more difficult to find help. They're at 240-777-1770. And we'll also put this on the website in our chat. If you have health coverage, they can help you find the therapist. It was hard to listen to the shooter's father describe his child's behaviors and know that he had no access to services that might have helped his son. It wasn't like that he was unaware that his child was in a crisis. It's one more reason that I'm exploring how the county could return to having community mental health clinics where any resident, whether they're insured or not, can get access to the help they need. These facilities were available in this county in the past, and now they're needed more than ever. I've asked Dr. Carl and our HHS team, along with others, to look into partnerships, feasibility, and costs to make this happen. Much of this discussion has been around school-age children, but the problems affect many young and older adults. And we need a comprehensive approach to this. And we will look to explore how we can step out and reach even deeper into the community and provide assistance. Finally, I want to mention that I was disappointed that Governor Hogan vetoed House Bill 862 and Senate Bill 163 that made some positive changes to election processes. This veto was announced late on Friday afternoon before a holiday weekend. It was not the most transparent way to announce this decision that's so vital to our democratic process. With this veto, which was made with no chance for the state legislature to override it, it basically ensured that our upcoming election results will be delayed 4 days. I agree with the governor that election security and voter confidence is critical, but disagree with his assertion that, quote, most scholars agree that abuse does happen more so with mail-in voting versus voting in person, unquote. The bottom line is that the pandemic forced many people to opt for mail-in ballots than in the past. And many have not only found that the process is more convenient, but also a safer way to vote during the pandemic, which is still with us. This is legal, safe, and a secure way to vote. I hope the governor and the legislature could come to agreement to go into special session to address the aspects of the bill that will lead to the delays in counting. This current bill would have allowed write-in ballots to have been processed prior to Election Day. This veto means that those ballots won't be counted until Thursday after Election Day. I don't think that psychologically people need to hear that once again, you're not going to know a vote result for 2 more days or 3 more days because we're not counting votes that were mailed in until 2 days later. I think it causes unnecessary anxiety. We've already seen what people are able to do with a story like this and spin it into a tale that has no bearing on reality, but still finds an anchor in the community. And I believe it would be worthwhile, if for no other purpose, to get into a special session to discuss amending the bill so that it addresses the part that is critical to getting the vote processed on time, and leave the rest of it for debate another day. It'll be little help to us right now to override this in the winter. The damage will have already been done. So I hope the governor will consider some way of ensuring that people have confidence in the vote by ensuring the votes get counted on time and not delayed. And having said this, I'm going to turn this over to Sean O'Donnell and Dr. Stoddard for their updates.
Thank you, Mr. County Executive. So taking you through the pulse report from today with today's data, I just want to start with an update on the variants that we're seeing now. I know we've had a few cases of BA4, I believe, identified in the state of Maryland, but this is a very low number right now, so we're still keeping track of this. Right now, the projection from CDC within our region is that the majority of our cases are the BA2.121. Looking globally, again, many parts of the world are showing decreased COVID activity this week compared to last week. Even North America has shown some improvement, with the US nationwide about an 8% improvement in cases. I think many of those are being driven by the northeastern areas that are starting to recover again from the latest BA2 cases. So as you can see, again, globally, most of the areas of the world are showing decreased cases. And we've mentioned this in past weeks, how we're monitoring closely, particularly the New England areas that seem to start with BA2 a little bit before we did, maybe about a week or so before we did. You can see the New Jersey, Massachusetts, New York areas, their case rates are already appearing to come down. And Maryland and Virginia, we're seeing some leveling already across the state in cases. As the county executive shared with you, we've seen some leveling here in Montgomery County. Looking at the numbers that just came through later this morning, we do see a jump up again today to around 400. That is very, very likely because of decreased testing over the holiday weekend and a larger number of people coming out again at the conclusion of their weekend activities, and that sort of surge of people testing driving that number up a little bit. Again, the gatherings that people may have done over a holiday weekend, that can certainly lead to more infections. And so it may not be surprising to see this go up a little bit over the next week or so, but it does appear that we may be reaching the leveling and eventually coming down from both of the BA2 strains. Again, as you can see from the lower left here, where we're just looking at unvaccinated and fully vaccinated, the unvaccinated populations within our county are showing more than double the rate of infection than the fully vaccinated individuals. And so it's still concerning that there are some populations out there who are not fully vaccinated. As far as who is getting it more recently, we have seen an increase over the last 4 weeks in the 5 to 17-year-old category, as this appears to be spreading in that age group. Not too much variance in the last 4 weeks by race or ethnicity. Our transmission rates, again, appear to have leveled off. They kind of fluctuate between 5 and 6% between public and private testing. Our our county testing sites are significantly higher than that. And then again, as was mentioned, the barometer of how seriously this is impacting our community is often on the number of hospitalizations, the number of deaths associated with COVID. We know that those case rates are PCR numbers only and don't tell the whole story of how it's spreading. Obviously, there's a lot larger number of people who are COVID positive that are not being recorded by PCR tests. But again, within our hospitalizations, we have seen that be much lower than the previous Omicron spikes. And we expect that this will probably continue to go up a little bit before leveling off as the hospitalizations tend to trail the infection rates by a week or two. Again, we've got our updated numbers in deaths for the previous month. We did see a slight increase over the month before that. And this likely, again, attributed to the very significant increase in the number of cases that came with this BA2 wave, but encouraging that it is much lower than previous waves. And again, looking at the activity of doses by age group, we see that most of the people coming in for vaccinations are the 50 plus looking for second boosters. We are seeing some people in the 18 to 49 getting their second or getting their an additional dose, as well as we're starting to see the 5 to 11s come in for a booster shot. Again, this data trails by about a week or two, so we haven't quite seen the larger number of those younger age groups come out. Again, not a huge change in the additional dose rates compared to about a month ago. Most of the different demographics have gone up by about 1% in an additional dose. Those are the updates we have from public health. I would just also mention we are working with our community health clinics in the Montgomery Cares Network to identify those clinics which are interested and able to both screen, write prescriptions, and fill prescriptions along the pathway of test to treat. And so we're working with them to try to, again, get them access to Paxlovid and potentially other therapeutics so that those are, of course, readily available to our community. There are many pharmacies throughout the county that can fill prescriptions. There's at least a dozen or more who do test to treat right on site. And again, the safety net partners in Montgomery Cares, we're looking to make sure that they have that ability as well. It's already been confirmed that a number of them will do screenings and write prescriptions for their clients. But we want to, if they're interested, we want to make sure that they also have those therapeutics on hand so that it can be a one-stop visit. That's all the updates that we have right now.
Good afternoon. I have a couple non-COVID related updates that I do want to provide that dovetail to some of the early things the county executive raised. So first off, obviously today is the first day of hurricane season. Obviously as an more inland county, we don't experience some of the worst effects of hurricanes, but obviously this is the opportunity to make sure that everyone has got their kit ready to go in the event that we do have, storms or tropical depressions, tropical storms and hurricanes that may come inland into Montgomery County. Last week we did have a tornado, an EF1 tornado in Olney, did do damage to a number of homes. So these are the kinds of things that we expect to see in our summer storms. And candidly, as we talk about climate change, we expect to continue to see more energetic storms into the future that could come along with some additional destructive capability from winds and heavy rainfalls and flooding and things like. So encourage people to be prepared for that and make sure that people have also got their supplies and their resources ready should that happen. The Maryland Department of Health also announced their first heat-related death of the year in Baltimore County. It was a 65-year-old individual. And so we do see a handful of these a year in the state of Maryland. So encourage people as these extremely hot temperatures, If you're doing work outside, make sure you're, taking regular breaks, consuming lots of water. And if you have underlying health conditions, just be very cautious about heat-related stroke and other conditions as well. The other thing I want to recognize is today is June 1st, so the ghost gun requirements begin to take effect today. The legislation from Montgomery County Delegate Lopez, the first part takes effect, which bans the purchasing, transfer, or sale of firearms that don't have a serial number, so obviously ghost guns. And if you do already own a ghost gun, you have until March 30th of next year to make sure that it is registered with the state of Maryland. So all those things are going to obviously help us in addressing this emerging public safety issue, the proliferation of ghost guns. We've already, at Montgomery County Police Department's already captured more ghost guns this year than they had the entire year last year. I think we had 71 last year, and we're over 100 already this year. So obviously it's an increasing problem in the state of Maryland and across the country, and one that we're appreciative of our delegation and the entire Senate and delegates across the state for finally helping us to address. And so we look forward to this taking effect today. So I will stop there, and I think we will be taking questions now.
I just have one update, Dr. Stoddard and Lorna, something that we've been planning for. Monkeypox, our team has had extensive training and conversations, not only participating in CDC related trainings, but the Maryland Department of Health related training, and we are prepared. We have been working with the Maryland Department of Health. We don't have any cases in the county, but as Mr. O'Donnell would say, preparedness, and Dr. Stoddard, preparedness is key. And so we have been prepared. We've been preparing, I should say, to identify, isolate, and inform the Maryland Department of Health through their reporting requirements, as well as the CDC. So we are planning along those courses, and should any cases be identified, we will issue a press release. But right now we are preparing and planning, and we have all the requirements in place per CDC's guidelines. Now, Lorna, over to you.
Okay, thank you, Dr. Bridgers. First set of questions, Kate Ryan, WTOP. Good afternoon, Kate. Kate?
Sorry about that. Hit the wrong key again. So a quick question on school safety. We're discussing ghost guns. We know that one was involved in the Magruder shooting, and you mentioned County Executive Elrich. This is the start of graduation season. We had a threat that was noted at one school this week. What are your concerns heading into the graduation season with so many people eager to be in person? And what are discussions with the police department about the role that police play in and around school safety?
I think you're going to hear a briefing from Dr. McKnight a little bit later. I mean, they've obviously modified the program regarding police officers around schools or in schools, and that's already in place. I think, we'll learn more, or you'll hear more when Dr. McKnight actually speaks later. So I'd rather let her take the lead on what they're doing. But we've been, working with the police and to make sure that everything they can do, reviewing things like what is the policy if someone is barricaded in the room, to the point of what happened in Texas. And that is not our policy. Our policy is, direct and immediate intervention. A very different policy, apparently. But again, I think you'll hear more about that a little bit later. I don't know if Dr. Stoddard wants to add anything to it.
Yeah, I think you're definitely going to hear more from Montgomery County Public Schools, but obviously the role that the executive branch plays in large part in this is, and at the direction of the county executive, is we've been really trying to address, how can we understand and address youth violence and youth conflict, youth mental health issues. And so the Department of Health and Human Services has been convening meetings, and this is going to include members of the community moving forward, discussing sort of, how we engage with different communities, because the issues are different in different neighborhoods and different parts of Montgomery County. We talked about this a little bit, but they've had a series of meetings and, are beginning to bring in different elements of the community. We've gone through our regional service centers to make sure that they're well integrated, just to make sure that we've got a system in place that will be a platform for us to address some of the nuanced issues that occur in different schools and different school districts and different clusters, and can move forward with that. Also recognizing, as the county executive alluded to, that some of the issues that we have with young people occur both in the school context but also outside of it. And so we're really making sure that the system that we have in place provides an interface for what MCPS is doing, but also allows us to address the concerns around youth violence outside the schools as well.
Got it. And one quick question follow up. I think a week and a half ago, there was a discussion about this all hands on deck interagency closed meeting. When are we going to hear what those plans yield for the summer?
Yeah, so we've begun to sort of branch out from that initial meeting based on some of the feedback that we discussed during that, where Department of Health and Human Services, Children, Youth, and Families, particularly in that section, have begun looking at particularly events that are going to be held throughout the summer that they're going to start to work with community groups to organize, where they're essentially community conversations meant to get community buy-in. And so that's one step that you're going to start to see actually events scheduled. I believe many Fridays across the summer are these events are going to take place. You'll hear those announcements coming out over the next, I'd say week to 10 days or so. They're going to focus on obviously community conversations, getting engagement and buy-in from communities. The police department obviously has, there are some activities you're going to hear about during the briefing in a few minutes with Dr. McKnight, but also they're also working behind the scenes to do some security assessments and evaluations related to schools and things like that. Just to, we want to, cross all those T's, dot all those I's to make sure that, what happened in Texas could not be replicated here in Montgomery County to the extent that we can prevent that.
Thank you.
Thank you, Kate. Reporters, I do not see any more requests for questions on the chat. Anybody else has questions? Going once? Going twice? Well, I guess that's it for today. Thank you, everybody, for joining us. Thank you, Mr. County Executive. We did have a hard stop at 1:30, so you're on time for your next appointment. Thank you, everybody. Have a great afternoon. Stay safe.
Bye.
Stay safe, everyone.